Welcome back to Before the Scalpel. Mindset over matter, your brain on pain. What we've learned is the central nervous system is your brain and spinal cord, and your brain and spinal cord is how all these messages are related from the area of the problem, bringing it to your attention.
So that makes the spine that much important because the spine houses the spinal cord.
Right.
So when the individual segments of the vertebra move out of position and put pressure on the nerves, they're interfering with that communication from the brain to the rest of the body.
Right.
So if we can find where that interference is and remove it, then the body works better.
Right. Your brain is your biggest player in pain.
Yes.
But it's also your most trusted helper in healing.
Correct.
So that information has to come to help the body heal, has to come from the brain, down the spinal cord, out to the nerve roots.
So series of traumas, which can be physical, can be emotional, and can be chemical, all affect the spine, but ultimately affect the brain. And so over time, there's a term called spinal learning. So as much as we can educate the spine to get better, the spine can also be educated to not function the way it's supposed to.
Right.
And that can affect brain function.
So in chiropractic, we commonly have this triad, and that triad is you have a physical problem, you could have a emotional or stressful problem,
Yes.
or a nutritional chemical problem. And all three of those have to be addressed. Commonly, a lot of people are just focused on the physical, but they don't consider the nutritional and they don't consider the emotional aspects.
Well, and one of the things with our exam is, of course, they're coming with the physical issues, and many times we'll find that these things exist that they didn't even know were there.
Right.
And so, obviously, with the neurologic exam that we can do, we may find some of those other things.
Right.
I mean, the physical exam, orthopedic we call it, where we put them through different movements and different things that, to try to figure out where's the pain coming from in the x-rays. That's the structural portion. But the other things, can be discovered as we go through the process.
Right.
So
if we use the analogy of let's say that your house is on fire,
Yeah.
and the fire alarm's going off. You can cut the wires to the fire alarm, but didn't address the cause, and now you're going to have a real problem in your house.
right.
So that nervous system is no different. That pain that tells you to stop doing what you're doing is important because you can't continue to injure and cause that inflammation.
Correct.
You got to let that dial down.
And I think a lot of drugs are designed to actually trick the brain into thinking whatever symptom is going on in the body has actually been resolved when it hasn't.
Yeah.
And so the brain continues to push through when
Right.
the body continues to break down.
Right.
So it's a Band-Aid,
Correct.
treating a symptom rather than a cause. And that's really where I think we differ from the medical perspective as far as drugs are concerned. We look for the true root of the problem.
When you go after the cause, whether it is physical, emotional, or chemical, when you address that cause, the body recognizes what you're doing. The brain also has to reset itself.
Yes.
Now, for an example, you brought up medication. We could say we go back to that professional athlete that got the cortisone injection in the shoulder or the knee and then is right back out on the playing field. They still have a knee problem. They still
Correct.
have a shoulder problem.
Right.
But that pain interrupter, that cortisone or whatever medication that they used to calm that down, that's going to hinder that joint, and eventually that joint's going to be an issue.
Right.
So
That's exactly right. Well, and that's where the simple misalignment of the spine, where the nerves pinch. That nerve is that communication highway, as we were discussing before, that communicates with the rest of the body. So if that nerve pinch isn't relieved, that message is never going to get quite the way through.
Right.
And there's a lot of times that people are, substituting with some other source of relief that's not really going to fix the problem.
And once patients figure out what is it that they need, then they seek it out.
Correct.
And the patient that we're going to go to, Rhonda,
Yes.
she's one of your patients, and
Yep.
she recognized times where she just needed to get here. She'd had the treatments, then she's recognized if she doesn't get the treatments, it stops her from living the life that she wants.
Exactly. And so sometimes there's a problem that we can maintain or avoid getting worse, or I don't know what the term is, but it keeps them going.
Right.
And so
Maintenance.
Exactly, tune-ups as we call them. But in this case, if she doesn't have the treatment, she falls backwards. So she continues up, the care conservatively, so she doesn't have to go the medical route.
Right. So be interested to see how you enjoy Rhonda's testimony.
Yes.
I couldn't sit, stand, walk, or lay down without pain. And I came in and got back on the DRX and with Dr. Null and adjustments, and the pain was gone. I come in regularly, once a month without fail, to maintain, and if I don't, I know it, I feel it. I don't want surgery, and the DRX keeps me out of surgery. If you live out of the area, you would definitely want to discuss your options with Powell Chiropractic and determine if it's a benefit to you to make the trip. It was for me. I live about 35, 40 miles away, and I would have gone farther to get satisfaction because I went to other chiropractors in my area and they said, oh yes, we do traction. Well, they do traction, but it's not the same as the DRX. Traction didn't help me. The DRX did. And I would go anywhere to get that relief without surgery. The staff here is so friendly. It's just like extended family. And they're very kind and they're willing to help and they'll answer any questions, and they're a good group of people. I couldn't sit, stand, walk, lay down. I couldn't move any direction without being in pain because my discs were compressing. And it hurts. It hurts like crazy. And at the same time, I didn't want to go to a surgeon. And this has just saved me all of that. I couldn't recommend this the Powell experience anymore. It's great.
What a great testimony by Rhonda. What an awesome patient. And it's great to hear things like that. It's encouraging and it basically validates what we do, and it's the reason we do what we do.
Right.
I just wanted to elaborate a little bit on the fact that, we have people come for treatment from all over. Mm-hmm. Not just in this state, not just a couple hours away, but across states. And people can come and see us from wherever they live, and distance shouldn't be an issue.
Right, and we see that a lot.
Yeah, we do.
I've been in practice 32 years. I can say commonly patients will travel from Michigan, we're in Ohio, from Michigan, from West Virginia, from Indiana, all of these different states that are adjoining Ohio, and they'll come and they'll even stay at a hotel, or they'll fly in we have an airport here in town.
Absolutely.
And they'll fly in and stay for a period of time,
Yeah.
fly home, come back, and we've been able to help them figure out a sequence for their care plan to give them the relief that they're looking for.
Absolutely. So, point taken, don't let distance deter you from coming
No.
to where we are. Another thing I wanted to elaborate on when Rhonda mentioned the difference between traction and decompression, very important distinction. Traction, which is a form of a stretching of the spine, let's say, for example, the lower back. Traction is a general stretch where all the segments of the spine are opened up. Decompression, on the other hand, is isolated to one specific segment. And in most cases, sometimes, I'm going to say in most cases, one disc can be the problem, or that can be the source of all their problems. And so our machine specifically isolates the disc based on the angle. Every disc in the spine is on a different curvature,
Correct.
Therefore a very specific angle. So the decompression, its technology, can specifically isolate the one specific angle needed to open up that disc and create the decompression process that allows them to heal.
The company that we purchased the table from did a research paper, and what they discovered is that traction, if we were to look at the muscles underneath the microscope, the fibers are called actin and myosin, and those fibers are intertwined like fingers of your hand. Traction will pull those apart, and traction typically, when they load the weight, it stays consistent. So that traction doesn't vary.
Right.
So let's say it's 10 pounds to make it easy. So in the decompression program, the straps are put on, the table begins to pull the person apart, also giving them a little traction.
Sure.
Then the table gives in at 50%. And what they discovered is that the water transferring into the disc space, attaching to that proteoglycan chemical like we talked about earlier,
Yeah.
when it's at 100% traction or 100% pull,
Yeah.
it doesn't have the greatest fluid movement.
I see.
It's at 50%. So it's the rhythmic motion of opening and closing that joint that gets the fluids back into that disc space.
Yeah.
And that's absolutely the opposite of what you would think.
Right.
When we first got the machines, we said, well, if 10's good, maybe 12's a little better or something like that. It actually is the opposite.
And isn't that the process we call diffusion that you
Correct.
were elaborating on
Yep.
many episodes ago?
Right.
Okay. So traction is one of the things that won't allow that to happen.
Correct.
But still, people think that it's the same. It's not.
It's not.
So yeah.
So when we go back to the brain is plastic. It's called plasticity. And what it means is that the brain can rewire itself. There's been cases where a patient unfortunately had a stroke, and then they are able to get that motion in the arm back or motion in the leg back. And then after they pass, they went back and looked at the brain. How did the brain do that? The brain will rewire around the damaged area. So that plasticity is the body's ability to adapt to a problem. So brain plasticity is what we're trying to work with in regards to pain.
Absolutely.
So someone has a pain signal. I hurt my arm or I hurt my leg. I have a bad disc. You get used to that pain cycle happening from every movement.
Right.
Your brain identifies that movement as a pain, causes the pain, instigates it.
Yeah.
Then after that begins to heal, the brain's still wired for that pain. So sometimes normal motion that's not even disc related or not even nerve related elicits that pain fiber.
I see.
The chiropractic adjustment, which is one of the key pivotal aspects of this program, is you reset that joint, you can reset that nervous system integration. You'll in turn reduce that pain cycle from happening.
So it's even more proof that the body is the master computer system out there.
So cool.
I mean, the fact that we were, wonderfully made, fearfully and wonderfully
Yeah.
made is an example of that,
Right.
because nothing can mimic the brain.
No.
And so we go by the premise that the body can heal itself.
Right.
And that's the process by which that happens, what you just described.
Right.
Right. The rewiring process. So no matter how bad things are, it doesn't hurt to try something naturally to see if you can do that rewiring
Right.
naturally.
So back to the table. So traction versus decompression.
Yes.
So when a patient is experiencing pain, commonly the muscles will tighten up.
Correct.
Or that spasm. So they're on the table in the beginning, the muscles go tight, it's literally pulling back against the machine. Inside the decompression, there's a sensor. Now these sensors are found in surface-to-air missiles. They use the same sensor. So in a surface-to-air missile, if the missile fires, if a wind gust comes against one of the fins in the back that direct which way the missile's going to go, that wind is resistance. So there's a feedback loop mechanism that's 1,000 times per second that's looking for that resistance. So when the patient's on the table and their muscles go tight, the machine gives in so that it's not fighting the spasm. So then the muscle relaxes, then the machine begins to pull again. So that's what makes this particular piece of equipment different than traction or some of the other machines that are available.
Absolutely. And that's the technology that has gotten us to this point.
Right.
And the development of that. So that's absolutely amazing.
It's really cool.
And very specific. So worth checking out.
Absolutely.
And so when somebody says go see Powell and see what their decompression machine is all about, that kind of gives you a little idea of what you're looking at.
Right.
Yeah. So.
And after we start to break these pain cycles, we help the patient reintegrate back into life.
Yeah.
And so like an easy example is if somebody is unable to walk or stand, the first thing that we have them do is stand for a period of time and then take breaks and then try to stand a little bit longer. Or walking, they may go 300 steps, then they try to go to half a block, then a full block, then half a mile. But you have to reintegrate that, and that's part of that rebuilding process,
Yes.
along with the rehab and the other factors that we have here.
Absolutely. And that's what makes our system
Unique.
what it is.
Yeah.
What it is. Absolutely. So yeah.
So we look forward to having you guys come to the next episode, Decades of Trust. So this practice has been here serving patients in the Canton area since 1970, and we're treating these patients one spine at a time. And we look forward to having you join us.
Powell Chiropractic Clinic introduces Discovery, the alternative to back surgery. The advanced Discovery protocols created in 2006 by the doctors at Powell Chiropractic Clinic are healthy and effective ways to avoid surgery and relieve pain. Innovators in chiropractic care, Dr. Jim Powell and Dr. Walter Null invite you to live pain-free, drug-free. Call today for a free no-cost consultation and preliminary examination. Powell Chiropractic Clinic, located on Munson Street Northwest in Belden Village and at powellchiropractic.com.